Okay. And to get started, let's do a quick round of introductions, starting with John from Kaiser.
Thanks, Patrick. Hi, everybody. My name is John Szczech. I'm a Senior Manager of Medicaid Programs at Kaiser Permanente. I'm here today to talk about Kaiser's approach to redetermination and the robust strategy that we have in place to support our Medicaid populations through this difficult transition period.
Thanks, John, and thanks again for joining us today. We appreciate the partnership. My name is Reva Sheehan, Senior Director of Customer Insights here at mPulse Mobile. I am coming up fast on almost 3 years here, but in my former life, I worked on health plan quality and Part D operations. So very familiar in the government space and happy to support our clients and internal teams in all of those efforts. Christian?
Thanks, Reva. Christian Bagge here. I'm the VP of Sales here at mPulse. Longtime work user and long time in the member engagement field. So had upwards of 10 years in engaging members and trying to get them to do what it is that their health plans want them to do. So been with mPulse for roughly 3 years now and lead a lot of the strategy as it pertains to engaging members within Medicaid and specifically redetermination.
Okay. Excellent. Okay, Reva, can you please lead off with regulatory updates on redetermination?
Absolutely. So I'm assuming everyone's probably pretty familiar with where we're at. There's been no shortage of information and coverage around here, but we'll just start back in December. The omnibus spending package basically decoupled the public health emergency and Medicaid continuous enrollment. So that gave us a clear path. We're going to start re-enrolling and reissuing coverage effective April 1st this year, regardless of the public health emergency status, which then it was shortly after that renewed for another 90 days. And now we have an official end date to that as well. I feel like it's all been a long waiting game over the last couple of years, and now it's kind of coming fast and furious. But the public health emergency and a lot of the other flexibilities impacted there will also end on May 11th of this year as well. Squeeze in between those two, I did find it really interesting. CMS provided a really robust strategic toolkit for states and plans to work together. So I think a lot of what we've seen over the last 2 years has been heavy on the state agenda and state initiatives of states being the ones kind of driving the bus to updating contact information. And now we're seeing a really, really strong call out for states and MCOs to work together. So in this strategic toolkit, that's what I'm calling it, they've called out specifically, plans are able to update contact information when obtained and confirmed by the member directly, and they can feed that back up to the state, which is great. So it's going to help kind of close that loop of data transfer or sharing information. States are being encouraged to encourage their MCOs to reach out to members using all modalities possible. So including telephonic and text to outreach to individuals to help them update their contact information, help them through the enrollment process, perhaps transition them from Medicaid or CHIP over to ACA or marketplace coverage when that's available under that same book of business. We're also seeing a strong call to of just great partnership and passing back and sharing of timely information and data. So I think it was really encouraging to see that coming out of CMS. And in there too, this is pre-FCC update. They did call out there are no federal rules prohibiting states and MCOs from reaching out in these instances. So then we see FCC declaratory ruling, which I'll get into that in just a moment, but that was in response to Secretary Azar's request or HHS's request last year for the FCC to provide clarification and give us some guidance and really give us like black and white, right? I think probably a lot of us see things that come out of some of the governing bodies and it feels kind of gray. So this one was a big win, I think, not only for those of us on the call, but also the beneficiaries and the enrollees that are going to need help, over the next few months. And then that leads us into another recent update. CMS is opening another special enrollment period. So a little bit shorter than what we saw in the early COVID days. It lasted over a year. But this is great because, again, we're trying to help promote continuous coverage, continuity of care. We don't want people to fall through the cracks, slip through the loops, if you will. So this special enrollment period is going to open up marketplace coverage for pretty much anyone. So now individuals will not have to go through the traditional, missing the word here, qualifying event, right? So they don't have to prove I lost my Medicaid coverage on day this, day that, and, you know, jump through kind of those hoops. They're just open, which is going to help promote a seamless transition. And I think some of this as well, and if you look at the timelines from the marketplace special enrollment period and to when that FMAP starts to decrease, those extra dollars that states have been getting during the continuous enrollment, we're going to see the biggest jump and likely biggest jump of Medicaid to ACA is going to match the biggest jump from that FMAP dollars as well. So I would imagine we're going to see a lot of activity, right, as everyone's gearing up, but also just moving individuals from state-based over to marketplace coverage. So lots of stuff going on. It is kind of exciting for all of us who have been waiting and watching and kind of rolling out 90-day update, 90 days. Now we're here, right? But the hard work begins. We have a clear path, but it might not be easy. But I do feel that, you know, a lot of what we've seen come out of CMS and now getting into the FCC update is really helping pave the way. Like I said, not only, you know, for those of us who are trying to help MCOs and states do the outreach, but also, you know, for the individuals, is making it easier, reach them where they are. Everybody has one of these in their hand, right? Almost everyone. And we know that these populations are digital, they're savvy, they text, they respond in multiple different channels. So this FCC ruling was huge. Like I said, it was, you know, kind of moving away from a gray space and calling it out in black and white. They say that the provision of a phone number on an individual's application for coverage is identified as express consent. So that's saying, hey, clearing the way. We don't have to reach out and call John and say, hey, John, it's Reva. Do you want me to text you? Is that okay? Right? Because that's a barrier. I've got you available. Let's go ahead and use that. So this is a great way to, you know, build regulatory or even procedures within the organization to say this is, you know, the kind of overarching ruling here, and that's what we're going to use within our states to go through this process. So also hope, fingers crossed, it might set a nice precedent as well for other similar outreach when you know, we've got the ability to get a hold of folks and help them with their health outcomes. So I think that takes us into our first polling question. So I'll go back to you, Patrick.
Perfect. Okay, here we go. Yes, it's been quite a journey, no doubt. 90 day after 90 day. Right. Where is your organization at with their redetermination efforts? We'll give you a few seconds here to vote. Sometimes it's helpful to get the temperature of our attendees on this subject.
I want to know where the Jeopardy theme music is right now.
We should get some background music. Wonder how much it is to license that. It's probably how they make most of their money. Okay, last chance before we share. Okay.
Okay, so this is interesting. So it sounds like, you know, about roughly half or just under half have a solution in place and are ready to go, which is great. It sounds like the remaining portion are either trying to figure it out or have a plan, but haven't put it in action yet. And so I think what this is telling me, no matter what you chose, you're very busy, either trying to get it into action or, you know, standing it up or whatever it might be, or even figuring it out. So thanks for the feedback there. That's great.
Thank you. Okay, moving on. John, could you provide some color on what Reva just covered and add what Kaiser is focused on within your markets?
Yeah, so, you know, I wasn't able to vote as a panelist here today on that that polling there, question there, but I'm pleased to say that Kaiser Permanente does have a great solution in place, and we are ready to deploy a variety of communications to support our members through this, you know, unprecedented eligibility event for our Medicaid populations. We talked also, Reva mentioned some of the, you know, waiting 90 days and seeing that extension of the public health emergency. But the great news at Kaiser Permanente is that we started very early. We actually started last year and partnered with mPulse at the time in developing a campaign for our Virginia Medicaid population in order to outreach them and prepare them for this upcoming event. I think that kind of preparation has been really important to our overall strategy in outreaching to our members and making them aware that this is an upcoming event. So one of the things that we did in Virginia is we utilized a variety of communications to outreach to our Virginia Medicaid members, informing them of what redetermination is, what they'll need to do, and how they can prepare now. It was a very effective campaign. You'll see some of the results here, but the biggest result for me, or most meaningful, is actually the first one on there. Over 2,500 Virginia Medicaid members have now updated their contact information directly with Kaiser Permanente or with the state. This allows us to be more prepared to reach out and accurately be able to contact these members during their upcoming renewal period. So just having that number in place and being able to partner with the state on being able to update contact information and allowing our members to update their contact information directly with our member services call center or whenever they walk into a Kaiser Permanente medical office building has been a great asset to us. So I applaud Virginia Medicaid and the opportunity to be able to partner with them early in order to prepare our population. Do you want to go to the next slide? Thank you so much, Patrick. So preparation is obviously the first step here, right? And I think we've done a great job of being able to send out a variety of communications. Texting plays an important role, as Reva mentioned, and as we'll talk more about later on Christian will touch on later on in the presentation today. And we think that those using a variety of communication modalities will be key to the overall approach that Kaiser Permanente is taking. But our overarching strategy is really to prepare the members, and so highlighting exactly what I just talked about with our Virginia Medicaid population. And then once renewal periods actually begin starting in April, is having the right contact information to target our members with a variety of communications using texting, email blasts, mailing letters, et cetera, in order to support and educate them through this difficult process. You know, one of the things that we talk a lot about at Kaiser Permanente is that a lot of these members may not have had to take any action related to their health insurance coverage, some of them almost for 3 years now. So this is a new event for them. This is a new process that they may not have gone through or that they haven't gone through for quite some time. So the necessary support will be in place. We need to make sure that we have not only those communications, but boots on the ground, right? Supporting some of the most vulnerable populations in our communities, which really ties to Kaiser's overall mission, right? Of supporting the communities that we live and serve. And so that education will be critical in targeting those populations and members throughout their renewal periods. Most of these members will have 45 to 60 days to respond. So getting quick messaging to them, supporting them through the process, walking them through step by step, is really critical. From there, after that renewal period is over, we also anticipate that there might be a variety of non-responsive members, right? How do we nudge them along? And I think Christian will talk about that a bit more also in mPulse's overarching strategy, but, making sure that we're nudging and appropriately messaging them, making sure to also avoid any confusion. So a targeted approach is incredibly important to Kaiser Permanente. Once that renewal period is over though, and the member is actually redetermined, this gets back to what Reva had mentioned around continuity of care. I think in 2021, we saw one of the lowest uninsured rates across the country, around 8% or so. We do not want to see that number tick up. We don't want members or any of our community members to fall through the cracks as they go through this unprecedented event. And so transition becomes incredibly important here, making sure that community members and our members here at Kaiser Permanente understand the options that are available to them in their geographic area, whether that be commercial or employer-based plans, through the exchange, et cetera. We think that we'll see a variety of movement and churn that will occur here. And it's important that everybody has visibility so that they can choose appropriately what plan works best for them. The other piece of this, I think, is also really important to comment on is just that support in choosing plans, making sure that they understand exactly, what this process looks like and how to support them through that transition period. continuity of care is something I think Reva also touched on that's incredibly important here. Here at Kaiser Permanente, and because of our integrated model, we think we're uniquely positioned to support continuity of care. So transitioning members so that they can continue to keep their primary care physicians is of the utmost importance. So we believe that this is a really robust end-to-end plan, really focused on supporting the populations and walking them through this process end-to-end. And we feel incredibly prepared to be able to do so. And looking forward to, partnering and continuing partnering with organizations like mPulse in order to make sure that we have strong results. I think I am handing things back to Patrick.
Indeed, thank you. Very helpful. You guys are doing great work. It's great to have that information with those examples. All right, let's have one more point question. Okay. Do you plan to incorporate texting as an outreach method in your determination efforts? While we give you some time to answer, I want to remind folks that we love getting your questions. We're getting some excellent questions in already, so please feel free. Happy to address those at the end of the webinar. Okay, a couple more seconds. Great participation. Okay, going once, going twice. There we go.
Okay, so I'll handle this and it'll transition nicely over to my section. So it looks like that folks are planning on using texting. They haven't, or 62% we're planning to use that in their outreach, which is phenomenal. 25% almost looks like they haven't tried texting, but will now in light of the FCC mandate. And then it looks like everyone actually is going to try to use it open to texting, but don't have it in our plans at 14%. So I think it was kind of a loaded question to tell you the truth, because for a long time, there wasn't a lot of clarity regarding, whether or not you were allowed to. And so I think, in light of what Reva and John have shared, that clarity is coming is becoming more clear, I should say. And so we're hopeful to see more people doing that digital outreach and using texting to engage people. So good stuff here. Thanks, Patrick.
Indeed. Okay, so Christian, we've heard about the regulatory overview and what Kaiser is doing and how they're approaching redetermination. I'm curious though, where does mPulse fit in? Can you give us a brief overview of helping your clients address the 3 phases of redetermination?
Absolutely. So for those of you that might not be aware, mPulse is a digital engagement company, and with big focus on our outreach being the text message. So we're a little different than your mom and dad's texting or what you might get from a provider's office. Our texting has conversational AI involved into it. So it's something where we ask questions and we get responses, otherwise known as bidirectional texting. When you do that, you get better outcomes, and it's a better customer experience or member experience. Along with that, we leverage something called natural language processing. So I don't know if anyone out there has ever had a text or been in a chat before, and there's an expectation that you're going to say yes or no, or which answer closely matches your feelings. Is it 1, 2, 3, or 4? And if you put something in there that isn't 1, 2, 3, or 4, or yes or no, it breaks, right? And maybe the message is, hey, you have to call customer service to get this resolved. Our solutions don't do that. Our technology allows that conversation to continue, because we understand if someone writes in yep, or like, I don't feel like I need to do this, we have a way to understand that and respond using our AI and that natural language processing. And additionally, we have a lot of behavioral science, which I'll get into in a second. And what we do when we run these campaigns, whether it's for redetermination or just about anything else the health plan wants to focus on, we always are focused on the end result. And so, working with John, we wanted people to go ahead and update that contact information, because that was the important thing. Yes, getting the message is important. Yes, making them aware, but really we want to see that action, and that's what we measure off of. And that's where you see the outcomes come up in the slide here. So If you go to the next slide to sort of dive in a little bit deeper, we've been doing this at mPulse for over 10 years now. So my background is, like I said at the beginning, is totally in the engagement space, and there's a lot of tricks in the trade that you acquire if you've been doing this for a long time, like I have, like mPulse has. And one of the cool things that we do, and I call it Jedi mind tricks, but the appropriate name is the use of behavioral science within text messaging, is basically to use things that it's known out there in the industry to get people to think a certain way or change their behavior. And when you leverage behavioral science to do that, using things like loss aversion or spark effects or these terms, what you end up with is more engaged and more likely to act on the action that we're asking them to take. This is not something that's acquired overnight. So those of you that have tried to set up these texting programs and maybe send off a one-way message, what happens with those replies? Are you actually getting the replies that you're expecting? Are you leveraging not only the behavioral science behind it in your message, or are you just writing the script, right? And so that's components that mPulse really does really well. And we've been doing it, like I said, for many years, and it's embedded within all these thousands of campaigns that we've run. And I'll give you an example of what a campaign looks like for redetermination in a second. So Reva, if you want to move on to the next slide. My big thing too, when I build my campaigns, is I want to make sure that there's 100% reach rate. And what that means is that every person within the membership has the opportunity to receive that message. Facts are what they are. You have people with mobile phones on your list, as phone numbers, and then you probably have those folks with landlines. You might have people have emails for some of them, but not all of them. What we try to do when we build these programs is to make sure that any line, any phone line that you might have, whether it's a landline or a mobile phone, we're able to reach out to them. So we're a multi-channel company, like I said at the beginning, and so we can use IVR, which is interactive voice response, to send a message out to someone via the landline. We can use that opportunity to collect opt-in information. Hey, would you rather receive this message via text message? Press 1 if so. If they do that, then pass me your cell phone number. And what we'll do is we'll enroll them into that low cost, high yield, response rate, which is the SMS program. And so, an example here is by looking at the totality of a membership and trying to reach that 100%, because when you reach the greatest number of people with the message, and the message is to educate them as to what's going on and what that next simple action is going to be that they need to take, you're going to get better results. And in the case of redetermination, you're going to get more people to take the actions required, which is something that John focused on earlier. So you might be saying to yourself, okay, well, this all sounds good, but what does it look like? And I always use this, I call it our snake slide or our Candyman slide. And what it is, it's a member journey, right? And it's specific to, basically we do 3 things within this, although there's many touch points in our campaigns at times. First thing we're gonna do is we gotta hook the member. We wanna send them a message that's gonna really, sort of cut through the noise and they're gonna pay attention to. The second thing is to educate them. And education can take a couple different perspectives. You can send them photo novellas. You can send them digital content, videos. We have Facebook story-like content that people will consume. And, not everyone learns the same way. So it's important to give them options. But again, educating them is super important, because if you educate them, they're more likely to take that next step. And the last piece of it is super important. What is that next step? A lot of times it could be just a website that's embedded within a text message. It can be something where it could be a phone number that goes directly to wherever you want that person to call into. So with redetermination programs, and we've been running them for many years before the PHE even started, we embedded a lot of that content and we saw lots of great results. But I think it's really important to where we fit in here as it comes to this outreach is making sure that you get that end result. And to get to that end result, we're going to use lots of different levers along the way, whether it's behavioral science, our technology, or even our digital content library, to get them educated, to get them to take that next step. If you go to the next slide, I think it's a quick overview. So you saw earlier, what we did with Kaiser as far as phase 1 went, which was the updating of contact information for Medicaid enrollees. Like I said earlier, We've done this for many years for lots of different companies across the country prior to the PHE. So we have experience doing redetermination even before this big thing that's happened. And I was laughing earlier because, as you know, the PHE always kept getting pushed. And when I started talking to people about it last spring, I'd say, hey, we're expecting the PHE to end on June 1st or whatever. And eventually I stopped putting a date in there and just had ... because it kept rolling over. But now we've actually reached the point where it's going to happen. And, along those lines, I think, working with someone that has an experience or has the experience of doing a good job as far as engaging members, Medicaid wide, we have run multiple programs using those, leveraging those, things that we have done in the past, even within that redetermination program, and executing on a bigger scale as far as this PHE is something that's right up our alley. And I think I'm going to end with just one little comment here regarding, so if you switch to the next one, Reva, the overview of who we are. So, we're not some company that just decided and raised our hand and said, hey, due to the, COVID happening, we need to get into the digital space. That is not us. We've been doing this, like I said, for 10 years, and we only do it within healthcare. We've done it with some of the largest organizations out there, but we also do it with the smaller regional plans and, even like the ACOs and IPAs and the like. So, we have this content, we can do it at scale. We had over, I think, a billion actual touch points with people last year. And we have lots of conversations that happen, and we learn from every conversation that we have with people, and we're able to report back on that as well, which is super important. So I don't want to spend too much time on mPulse, but I think we're uniquely positioned to help people out and or help out some folks that might be looking for some help. So I just wanted to make sure that you had a little background on that as well. With that said, I'll be quiet and turn it back over to Patrick, because I think we got some good questions here.
We do indeed. Thank you all for the great questions that have come in. There is still time, so please don't be shy. We love getting your questions. And also, Christian, it was great to see so many MHPA members, right, on that list. So I think that goes to show the good work you guys are doing, and the members as well. Okay, so we have some great questions. Christian, I'll do my best. They're all good. Let's start with John. In your professional opinion, how do you see the next 12 to 14 months playing out? Is it going to be chaos, or are unqualified Medicaid recipients going to be heading to exchange plans? How do you see it?
Thanks, Patrick. Yeah, I do not think it'll be chaos. However, I think health plans and Kaiser Permanente is incredibly prepared to be nimble through this process. I think we have to continue to review and analyze how effective our communication strategies are. We need to see what the results look like and continue to monitor our overall performance. Again, keeping in mind that we need to ensure that we don't see these members fall through the cracks. We want to make sure that we're finding a home or some kind of product if they no longer are eligible for Medicaid, and also retain them within our Medicaid products and continue to support them through Medicaid coverage. So I think that, chaos, no, but an ability to quickly turn and pivot your strategies, as well as make sure that you're closely monitoring overall success and performance. And also hearing from feedback from partnering with the state, right? They're going to have a lot of visibility into, what is going on with these populations. And so it just really shows that that state and health plan partnership is going to be incredibly important. We really value our relationship and partnership with our state regulators. Right. And I think keeping a close eye and partnering with them to better understand what they are hearing and what we're seeing will only lead to good results for our communities.
Perfect. Thank you very much. One more for you. This is a great question as well. If you asked a member to update their address with Kaiser, did VA allow Kaiser to update it for the member, restate Medicaid, or does the member have to do it twice?
Again, I'll applaud our state regulator in Virginia, the Department of Medical Assistance Services here. They received approval so that we actually have a communication loop where a member can actually walk into a Kaiser Permanente medical office building, update their contact information within our systems, and we send that address back to the state, and then it's validated and becomes their permanent record. Similarly, they can call our member services call center or reach out to Kaiser Permanente through a variety of channels to update their contact information, which is exactly the messaging that we included in our communication campaign last year. So because of the great work that the state of Virginia is doing, Commonwealth of Virginia, is doing, we are pleased that that communication loop is in place and it becomes an actual permanent record for the member. You know, a lot of these members are transient. We're in Northern Virginia, right? And so you have members that are moving around. They could even be moving from state to state, right? In the Northern Virginia area into DC
Right.
or into Maryland. And so just continuing to make sure that we have updated contact information and that the state is aware of where these members are located is a net positive for both the health plan as well as the state regulator.
Perfect. Thank you. Okay, let's move over to Reva. Is the fact that the federal government is providing guidance while state governments might not be commenting anything new? For example, the FCC ruling compared to how states like Arizona are largely silent on the use of texting for outreach outside of referencing use of all channels in outreach.
Yeah, I mean, I really think that this is as black and white and as clear as it gets. And we've seen a whole different variety with the clients that we work with, back in, I think it was late 2022 or late 21 or early 2022, DHCS in California sent out a memo to all of their MCOs saying, text people to ask them if they want to be texted about important information related to their healthcare. But the state of California in general was still really hesitant and didn't adopt that, right? So we're seeing a lot more movement now. I think people are feeling more comfortable. We're taking this FCC ruling. We're looking at if there was a Supreme Court ruling a year or so ago, identifying that as long as the message is not coming from an auto dialer, it doesn't, break those TCPA rules and regulations. So we're starting to couple these things together. And I believe that that's going to give a lot of support to states. And then as we see other states take initiative, which California now is updated that they're moving forward. And John can speak to this. I know he works, directly with some of those entities as well. But I think as we see positive change in movement and we see other states being innovative, taking this lead from federal government and other regulatory space, that it will pave the way for other states who are maybe a little more hesitant, right? And I think a lot of it just comes down to really secure policy and procedure, always protecting the beneficiary. That's key. CMS will side with you every day, right? When you're doing the best by the members. So yeah, John, if you want to give a brief update on California, I think that's a good one to note.
Yeah, I think just in general, we see different states that are further along than others. I think the great thing to note here is that we're all aligned on what the goal is, right? We all want continuity of care. We want to continue to keep the uninsured rate very low. And so it's continuing to have that dialogue with our state regulators is incredibly important. At Kaiser Permanente, we know that texting is a very effective way of reaching our members. And so we would like to have all types of communication modalities available to us to outreach to them in order to reach that same goal and objective that we have with our state partners. Other instances that I can call out is that we're continuing to see differences state to state with what data will be available. What we are referring to as global language toolkits. Reva, I think you called them strategic toolkits, but really what is that language? What is the direction? What is that pre-approved creative content or call to action? The more that we receive that information and what the state is requesting us to do, the better, because then we know that we're in full alignment with their rules and regulations and ultimately what the goal is and how we're directing our members. So I think that continued dialogue with the states is incredibly important right now, and just recognizing that we all have the same goal in mind.
Excellent. Thank you, John. Okay. We have another question. Will the slides be available to attendees? Yes, you can contact our presenters directly. They'll send the slides to you, or if you'd like right now in the chat, if you just press 1, hit enter, we can also do it that way if that's easier. So you have 2 options, press 1 in chat, or you can, at the end of the webinar, we'll give you the contact info for the speakers and they'll send them to you directly, okay? So we can definitely help you with that. You can always contact MHPA too. We'll forward you on to the mPulse team. Okay. All right, another question, I'll just leave this open for who wants to answer it. For the redetermination product solution, is a call to action to update contact information, or is it to go to the state website and re-enroll? Thanks.
So I could take that one, and then John, Reva, feel free to jump in. So the call to action, I think, is dependent upon what phase you're in, right? So initially, when this was rolled out last year, it was a 3-phase sort of unwinding. And phase 1 was, asking health plans to work with the states to get updated contact information for their Medicaid beneficiaries, right? they wanted to do that in order to make sure that the mailings or the whatever it is that they're going to send out specific to redetermination would reach the right person, right? So again, we're talking about reach rate. Phase 2 is specific to the actual redetermination process. So that's going to be a different call to action. So phase 1 would be pretty specific. Hey, we want you to update contact information. We can point you in any number of directions. You can go to KP, like, we did it within Virginia. We can direct you to the state agency or county agency where you need to update it. With the actual redetermination piece, once again, it's probably going to be more focused towards the state Medicaid agency and their what their process is. Although we're open to, we could direct people wherever is best available. Phase 3 was the idea that you're going to have a lot of folks that probably will no longer be eligible for Medicaid, due to making too much money or whatever it might be. And so we wanted to provide them with a soft landing. So phase 3, and this is another place that mPulse can help, is that if you have an exchange or if you want to provide that member with a soft landing with continued coverage, then you can actually reach out to them in a marketing type of manner to let them be aware of what other options are available. And again, those options are customizable. So if you work with a health plan that does have an exchange plan, we can sort of surface that information and start the conversation there for that person to have that conversation. If it's more of along the lines of, hey, we want you to go to the state exchange and figure something out, we can do that as well. So I think, my position on it is it's fully customizable. We're going to work with you to understand what it is that your state or org would want, would suggest, or which direction you want to go. And that's the campaign that we would execute. So John or Eva, any other comments on that?
Yeah, I'll just add, if we look at, kind of the different populations and groups that are going to move through this phase, right? We have folks that are long-term disabled, the ex parte or passive enrollments are going to happen. And those that are going to retain coverage will seamlessly retain coverage. You're still going to need to let them know, hey, you've been awarded coverage for this term or a period of time. We'll have people that are going to have to do something. You're going to have to reapply. You're going to have to provide documentation to support, the financial need for these state-based assistance. And then you're going to have those, because we do have some states where, same as that kind of passive activity, where we have been collecting, or not we, but the states have been collecting, tax information. We have, someone's been paying income tax, right? So now we have a good idea, or knowing that folks are not going to qualify. So we can take them proactively before they have this massive drop off and reach out to them to let them know that this is coming and this is where you need to go, right? So I think, again, then it's kind of move, reapply. We've got to notify folks that are going to retain coverage. And then those that we know are not going to qualify, that we can still use these means and modes to move them so that they don't lose coverage, right? Because what did everybody think pre-pandemic? That ACA is expensive, or I can't afford this, or maybe they never tried to qualify for it before, right? We've got a ton of people who've never gone through any of this process at all. So how do we get that information to them and in their hands and let them know that subsidies are at an all-time high, so premiums are at an all-time low, right? So we have to, that's where some of that behavior change comes into play. And so we'll take that and put that in the language to let people know, like, hey, this is available, it is affordable, or these are the ways that you can connect to these other resources.
Excellent, very informative.
I would just add to that, I think that the most important thing here is to be targeted and careful about our approach. We want to avoid confusion in the marketplace and confusing our members here within any health plan, right? The state can only go through and renew 1/9 of the total population every month. So we don't want to outreach to a member that won't be up for their renewal until January of next year and April of this year, right? That causes confusion for that member. They could be alarmed and think that they're immediately losing their coverage, which is not the case. So I think just being very careful about your overall messaging and being as targeted as possible to avoid that kind of confusion will be critical to avoiding some of the potential chaos that Patrick highlighted earlier on in the conversation.
Thank you all, very helpful. Okay, let's go to another question, but before we do that, one last reminder, there's still time, folks. We love your questions. I think they benefit everyone. So we encourage you to please send more. Okay. What would an example of language that you would recommend around educating people around that exchange marketplace space? How would you make that available if they're no longer eligible for Medicaid, or does that depend by state?
So My interpretation of that question, or like how I might respond to it, is that it is going to depend by state. You have certain states, and I think John alluded to this earlier, where they actually give you what the language should be. There's packets, like this is what should go on your website, this is what should go. And primarily what I've seen, and I don't know, John, maybe you're a little bit closer to this, I've seen primarily language specific to redetermination. When it comes to the specific language provided by a state to move them onto an exchange plan, I haven't seen that too often, so I don't know if that's the next shoe to drop. But we at mPulse definitely have language that we've developed that would basically educate them and make it make sense as far as why they're in this position and what they need to do to take action. But I don't know, John, if you want to comment on that or not.
Yeah, sure. I mean, I don't think I'm the messaging expert here. We rely on a variety of marketing teams as well as people like you, Christian and Reva, to help support some of the most effective messaging that we can in order to outreach to our members. However, what I would say is that I think that we need to be very clear around what options are available and what the call to action is based upon your geographic location. It will definitely be different state to state. We're going to see a variety of special enrollment periods, I believe, depending on where you are located in order to support overall enrollment into the exchange. We're also going to see a variety of new rules that we expect, such as, auto assignment, auto enrollment, and stuff like that, that could occur, depending on where you're located. So as long as we're continuing to be very clear around what those options are, focusing on continuity of care and how to retain coverage, I think that, that's the right messaging to focus on for those members who no longer qualify or are eligible for Medicaid.
Yeah, and I'll add one thing coming out of that, what I've been calling a strategic toolkit from CMS. One of the call outs there too was that CMS encouraging states to expedite their review process, right? So if you don't say, maybe I don't want to use this pre-approved or state-based content. I want something a little more specific to my own organization. States have been encouraged to expedite that process too. So that could be helpful to leverage that.
That's a great point. And, I think what I heard John say is it's not a one size fits all approach, right? And being as personalized and as pinpoint, accurate as far as the information and what the ask is super important. And I mean, that's true in life, just like it's true in this redetermination.
Absolutely. I'll echo that. All right, we got a new question and you're still time, folks. Christian, how quickly can these mPulse solutions be stood up?
That's a great question. Typically it's less on mPulse to get these things up and running than it is on the health plan. And to be fair, once we get scripting approved from the health plan, if it's a Medicaid type of campaign that we're discussing here today, a lot of times the states do have to approve it. So, once we have approved scripting, we could typically get these things up and running within a month. Obviously we can help you out. Don't wait till the last minute though, because that can get a little hairy if you do that. But the big thing though is typically, the state, reviewing things, and some states are a lot better than others. We run programs in over 30 different states specific to their Medicaid memberships. And so we can tell you some states take a little bit longer, but I think Reva made a great call out there just a second ago, because there is language there saying, hey, if you get something and it matches up with our language that the state has already disseminated, it should be a rubber stamp. It should get approved. Now, if you want to change that a little bit, it still should go to the top of the pile. And so you shouldn't be waiting 6 months to get approval like maybe the case was in certain states in the past.
Yeah, and even just a mention of, this individual states that we work with, we're currently working with about 30 managed care organizations across those states too. So think of that as, we've got access to a really great repository of this is what we've seen approved in Maryland, this is what we've seen approved in Illinois, that sort of thing. So we're always taking that ability to see what's happening and getting approved at other states, and then we can kind of reapply in some of those cases too.
Okay, excellent. All right, folks, before we close out, I want to thank our speakers and give them the opportunity to give any last thoughts. And then, like I said, I'll close this out. Christian, you want to start?
Yeah, no, I really appreciate everyone joining today. I think this topic is one that's been on maybe not top of mind, but has definitely been on people's minds for over a year. And like I said before, I think I've learned a lot, and mPulse is definitely uniquely positioned to make a difference. And I think that's the main thing is we set goals, we aim to achieve those goals, whatever that end result is that you want. And in this case, it's going to be for the public benefit, which is kind of nice, and we like that.
Indeed. Reva or John?
Yeah, I'll just say, I think just 2 weeks ago, I finally took off that recurring calendar reminder of follow-up and tracking. Like, are we going to get 60-day notice? Are we not?
Right.
Are we going to renew? Are we not? But again, I think we've all been working towards this, right? Whether we've been actively engaging our members or actively, participating in whichever phase the state or the plan might be in. So I feel like everyone should be pretty well set for, at least a good strategy moving forward. And to the 20 or 30% who weren't quite sure yet, it's never too late. So as Christian mentioned before, I think we're well positioned to help support. And again, just we're talking, business and people here, right? We want to avoid avoidable churn, right? So we want to keep people within our book of business, right? As a health plan, because we know we can take care of them better the longer they stay with us. But really, I think it's about, when you look back at some of the information that's come out of CMS, it's really about the individuals, right? So it's not so much the business and the administrative lift. It's really just taking care of the most vulnerable people, or the people that need the most help. So I do really appreciate, some of that information that's come out recently to support those activities as well, regardless of, the business aim.
Agreed. John?
Yeah, thank you, Patrick, Reva, and Christian for including me in today's discussion. It's been really fantastic, and I hope it's been valuable to the audience today. I think that reflecting on the last 3 years, I can't believe it's here. I can't believe that April 1st is right around the corner. But Kaiser Permanente is well prepared to support our members. We look forward to executing on our strategy and retaining and supporting our Medicaid populations as best we can. So again, thanks so much for the opportunity to speak with you all today.
Okay. And again, I want to thank our presenters. I want to thank our attendees, not only for your participation, but your questions. Again, you can reach out to mPulse. We'll get you the slides, or MHPA. And then lastly, this presentation was great for a lot of reasons, but the one thing I think that's most important to MHPA and our members is that Medicaid member and the continuity of care, to echo all three of our presenters, but John as well, used those words, and it's exactly right. It's about the member and making sure they have that continuity care. So thank you all very much for the work that you're doing. I know I learned a lot. And next, actually, I think in 3 weeks, we'll have a new webinar Wednesday for MHPA folks. So please join us then. But in the meantime, have a great afternoon, and thank you for attending. Bye-bye.
Thanks, John. Thanks, Patrick.